Okay, hi, my name is Lydia Stahl, and this is case study number 2 for the communications portion of Intro to Veterinary Technology at Becker College. So we're going to start off here with the type of information or the types of information that should not be included in a patient's medical record. So at the top of the list here, I put false information. That's a big one. Any spelling mistakes should be corrected or rectified. So any information that is false or not pertaining to that patient should definitely not go in their record. That's a big one. So another thing that should definitely not go in a patient's medical record is any personal information about a client or any, personal information about that client that they really don't want in their pet's medical record should definitely not go in there. That can be considered a little bit unprofessional if that is included. And again, you're to date and initial everything you enter, so people will know who put that in that medical record if you are doing that. So let's try and keep things neutral here. And just don't include information that doesn't need to go in there. So I put occupation usually okay. So a lot of the times, or sometimes rather, a client's information or occupation information can pertain to a patient's health status or what's going on with them. Say it's stress or something like that. Um, Sometimes we'll ask what a client does for a living to see if that could have anything to do with it. Um, and so we also, of course, don't want any personal opinions about clients or patients going into that medical record. So, like I said, you want to keep things neutral, 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 neutral. If you have a negative opinion or you just don't like a specific client, you should definitely not have that opinion apparent in that client or patient's medical record. Excuse me. Um, you know, we come across patients that we're not totally fond of. That can happen, but you, of course, again, don't want that to be in their medical record. Um, this kind of goes hand in hand with the last bullet there. Any negative connotations about a specific client, say they're not the best to deal with. Try and keep that neutral. Put that in the most neutral of ways you can. Sometimes you really don't need to include that they're, a pain in the butt to deal with. That just happens, and it's kind of a part of dealing with customer service, unfortunately. But you definitely want to keep things as neutral as you can in a patient's medical record, especially when nowadays with electronic medical records, they can look into their medical record or their patient's medical record and they can see what is written in there. So, you want to keep things as professional as possible, like I have said before. Um, yep, and the biased opinions that kind of goes with that, and or biased opinions about the client's care. Sorry about that, of patients or of their patient, their pet. You want to, unless it's necessary, unless it's like a neglect type situation that would need to be recorded. Just try and keep your personal opinions out of medical records. Um, so, like I said, any information that's not pertaining to that specific patient whose account or file you are recording the information in should definitely not go in there or not be kept in there. Sometimes things can happen, this can happen with paper records or with electronic records. This can happen a lot. Say you're inputting medical information, vital signs into a record that you think is a specific patient's medical record, and you look up and you finalize things, and that is not the right record. You need to get that rectified immediately, or if not, as soon as possible by someone who can, if you cannot do so. Um, so, for paper records, for those clinics or hospitals that have not switched over to the electronic um, record holding systems. So anything written in a paper record in any other ink color than black cannot be in that medical record. So you need to be writing in black ink only in those types of situations. Okay, so moving on, these are the components of signalment. So signalment includes the name of the patient, age of patient, gender and reproductive status, species, breed, and the presenting complaint. So this information here is actually after one of my own pets who we know longer have anymore, but I just used his information because that was easy for me. So, if you are putting a patient into a room for a doctor or starting off an appointment, the signalment that you would use to that doctor when you tell them that that patient is in that specific room would be Charlie, a 7-year-old male neutered beagle, is in room 2 for complaining of lameness of the right hind leg. That would be an appropriate signalment for you to use in a clinic setting. So moving on. So this is kind of going back to what to not include in a medical record. So if you do see an error or make any errors in a medical record, there is a proper protocol to follow or a proper way to correct an error in a medical record. And so I have a example here of what to do. So what you want to do is draw a single line over the error in black pen. See, black pen, you want to always use black pen. And you want to write the correction beside, or if you don't have any room beside the error, you want to write it above the error. So you want to be writing your correction beside or above the error. And then you must also initial and date all errors and entries. This is a big thing. Don't forget to initial and date all errors and entries. Anything you're entering in a medical record should, of course, be dated and initialed. All right, next. So next we're going to be talking about the benefits to having electronic or online veterinary medical records. So some benefits include quicker access to patient records. So, you're not digging through a whole bunch of files to try and find a patient record. You can just, click, there you go. So another benefit would be the ability to easily share information electronically with patients and other clinical professionals, clinical or medical professionals. So, you don't have to be copying and mailing or faxing. Well, I guess you do sometimes fax, but you don't have to be going through all of that paper and all of that, that those steps to be sending a record. You can just click on the record, click email. There you go. It's off in cyberspace to be sent away to who it is addressed to. Legal documentation promoted, so you can, have legal documentations that clients and owners need to sign in order for their pet to be treated at your hospital that day, or, for example, unfortunately, any euthanasia paperwork documentation that needs to be signed. You easily have access to that. You don't have to continue to make copies of the same document and have it in a big file, physical file cabinet. To have on hand. You just, have it in your computer and it's easy to access. Excuse me. So productivity and efficiency improvement. So, things can move quicker, more effective, in a more improved way. I think a lot of clinics who have switched from paper to electronic. Sorry, let me silence that. I'm so sorry about that. Productivity and efficiency improvement. Yep. So, like I said, it's more efficient to have the electronic record keeping than paper electronic record keeping. Okay. So, eco-friendly. So, this is also environmentally friendly. You're not keeping as much paper on hand. You're not using as much paper. You're not disposing of as much paper, and it's a lot better for the environment than keeping paper records. And this can also, some benefits can also include the reduced expenses in terms of paperwork storage or expenses that go along with paperwork storage. You have to keep your paper records on hand for a total, I think it's 5 to 7 years. So all that paper records really build up over time. And so you obviously have to pay for storage of that, which can be a pocket pincher. So this, well, this kind of goes hand in hand. Reduced file space, so you're not going to have all of that space where the records were kept. People or clinics rather have walls and walls of records, and that takes up a lot of room. And not to mention, it is an eyesore. Um, but yeah, so clinics that have switched over to the electronic record keeping, they definitely have way more space, space for more computers. Um, and, clinics that have switched from paper to electronic, again, I'm going to go back to the productivity and efficiency improvement. They can attest to how faster and easier things are. And, they're more productive. They can, move people in and out quicker than they used to be, and, handle way more than they used to with paper records. Um, so improves quality. So, you have an improved quality of work. Your clients will be, potentially more happy because things are moving quicker. It's easier for them, things like that. And I put in parentheses theoretically for this, but the reduced medical errors. So, with paper records, things can be misread, written down incorrectly. Again, there's always going to be room for human error, but the thought behind electronic records is it's harder to make those mistakes, but easier to rectify and acknowledge or realize that there's a mistake there. And another benefit, lastly, would be organization, financial and operational benefits. So, instead of having loads and loads of file cabinets where you have to dig through the files and figure out what you're looking at and what you're looking for, you have a computer that has everything so nicely organized right there for you to access. So, moving on. So, this one I had fun researching. So, risks associated to having electronic to online veterinary medical records. So, of course, with the good there comes the bad. So, you know, electronic records to get them, it's expensive, and it's just getting more and more expensive with the higher technology that is being discovered or introduced today. So you really have those high upfront acquisition costs of being able to wire your whole hospital and set up these servers for having this electronic record keeping. Workflow disruptions. This is a big one. I have personally experienced this. So electronic records aren't foolproof. If you don't have the computer on, you can't look at the record. That's a big thing. So if you can't turn the computer on or you can't turn the server on, or if something's happening, you can't access the information that you need to access. Whereas with paper information, there was no glitches or not glitches, but there was no system failures with in terms of electronics, things shutting down with paper records. It was paper. You could just look at, you physically had it in your hand. But with electronic stuff, if you have a power outage, you're SOL for sure. Technical difficulties, server crashes, power surges, those things can be extremely frustrating, and they do result in temporary losses of production where you are just sitting like a sitting duck. You can't do anything because you don't have a computer, you don't have your records, you can't input information. But a lot of clinics, have systems in place where they have some paper records on hand that when their electronic records fail, they can write stuff down and input it in later. So there's always some ways around that, but in other terms, there's some things that you just can't do if you don't have your computer. So some other risks or issues associated with electronic record holding is training difficulties. It can be difficult to train people who are not used to working on a computer how to work on a computer. It can be, almost impossible. So that can definitely be hard. And not to mention, you have to spend a lot of time if you switch from paper records to electronic records, training your whole staff how to use that program. You're going to have to do this anyway to get new people, and when you hire new people, or in other terms, when a clinic hires new people, they're always going to have to get trained. But, the first initial swap over is definitely a hard one. And so I put the non technologically gifted. So, you're going to come across those people who just are not good with computers, and they do not know what to do, and they make a lot of mistakes. And sometimes it's like, I don't even know how to fix them. But Yeah, but I mean, everybody's got to learn how to use those systems and be able to use those systems to work in an environment like that. And I just included this picture here of a lady screaming at a computer because I feel like we've all felt this way in our lives, or will feel this way in our lives about technology. It's great when it's great, but when it's not great, boy, is it not great. But it has proven to be more efficient, and it can be a breeze when it wants to be. So. Well, I hope you have enjoyed my presentation, and thank you so much.